Hi, I'm Lawrence Ferrara, and I am a chiropractor and now a law student. And I want to talk to you about something that you do every single day and probably don't even think about it. That is your breathing. And I want to ask you a question. That is, how should people breathe? What is the normal, natural way human beings are designed to breathe? And before you answer that, I don't even want you to answer it yet. But before you do, let's think about the anatomy and physiology of the body. And it won't be that in depth, but I want you to think about, first of all, what is in your nose? Because you only have two choices, right? Your nose or your mouth. So should you breathe through your nose or should you breathe through your mouth? And that's the question. Before we answer that question, I want to ask you to think about and let me know what you think. What is inside of your nose? And I want to hear you say it because this should be more interactive, even though it is a video. What is inside your nose? Now, I don't hear you. Yeah, okay, great. Okay, so hairs, right? So that's part of the mucus blanket that sweeps all the toxicities from the outside world that get into our bodies, part of the immune system. And exactly, mucus. Mucus is in your nose, right? We know that. Now, is mucus good or is it bad? I want you to think about this. Okay, everyone's saying it's bad because we know when we blow our nose and maybe we have allergies and too much mucus, but we're not talking about when it's too much, but just regular mucus is a good thing. There's IgA inside mucus. There are antibodies inside your mucus. And that mucus is there for a reason, to sweep through, it's called the mucus blanket. And it sweeps through the body, the nose and the mouth and the throat, and it goes up and down with those hairs that you just said. And it moves the mucus blanket so it's a way to eliminate toxins from the outside world. Now, the problem is when you don't have mucus, I want you to think about this. If you don't have mucus and you don't have the IgA, the antibodies that protect you against bacteria, what happens? And you're right. What happens is germs proliferate. The normal germs that we all have proliferate. So we need a mucus. For instance, if you didn't blink, because mucus is also in the eye called tears, and if you didn't blink, say for an hour or so, it would get red. Think about this. And if you didn't blink for maybe a day or two, bacteria would decompose the eye. That's what we mean about the mucus. It's protective, and it protects from the bacteria from the outside world, and also bacteria, the normal flora, the normal bacteria that we all have, but the mucus keeps it all into balance. Now, I'm talking about this whole mucus, and you might say, what does it have to do with breathing? Because we don't want the nose to be dry. If the nose is dry, without that antibody and that protection, then you're more vulnerable to bacteria, viruses, fungus, and all kinds of, and pollen, and all kinds of allergic reactions. So we want that mucus to be in the nose, and the way to keep that nose moist, the way to keep that mucus from drying up is exhale. So if I ask you, what is the best way to breathe? And of course, breathing is inhale and exhale. So we want to exhale through your nose in most instances. Of course, I've never treated you or provided history and exams, so no medical information or advice is being given, but from generally what I talk to about my patients, talk to my patients about this very subject, is most people under normal circumstances are designed to exhale through your nose. That moist, warm air exiting your lungs is designed, I believe, to keep the nose from drying out, because when you don't have the mucus, we already know bacteria can proliferate. And I want you to think about this. For instance, why do people have morning breath? Okay, that's like bad breath in the morning. What is that from? Think about that. It's from the elimination and drying out of the mouth, maybe from either drinking is a dehydrating agent, or sometimes people breathe in, sleep apnea maybe can cause it, or people with open mouth during sleeping. So if that dries out, you get bad breath in the morning, and that's the germs that cause bad breath. And of course, Listerine and all these other antiseptics tell you that you need to have that in the morning to eliminate the bad breath. But I'm saying that if you keep it moist, Anytime the body is kept moist, that mucus blanket is proliferating, you don't have the bacteria. And I want to drive this home with a vivid example, and that is, why do dead bodies smell, right? That's how sometimes people know there's a dead body in some house that's locked or some apartment, because it smells. And the reason why is because there's no mucus secretion in dead bodies. My point of saying this is to have you remember that mucus is a good thing. Mucus is in your nose, and we just learned why. And it can easily dry up if that precious, warm, moist air exiting your lungs comes out your mouth instead of your nose. You want that moisture. As a matter of fact, viruses are just as prevalent in the summertime as the wintertime. So why do people get the flu, for instance, or colds in the wintertime? And that is not because the virus is more or less prevalent, so says the Mayo Clinic, but because of our vulnerability. We are more dry. Our noses were dry in the wintertime, obviously. And so and also I wanted to bring your attention to this. In the summertime, when you go out, how come you don't have a runny nose? But you do in the wintertime, right? You go out, you walk around in the wintertime, and it's cold out, you have a runny nose. There's a reason for that. Mother Nature is very smart over millions of years of evolution, and she wants your nose to run in the wintertime because you're more susceptible to viruses and other things too, probably. Colds in the wintertime, and that protects it. As a matter of fact, chicken soup is, they say chicken soup is good for colds. And what they found is that it's not the chicken type of soup, like chicken soup is good for a cold, but any soup, because soup makes your nose run. Again, we're pro-mucus here, and we want to make sure you understand that mucus is a good thing. Mucus can cause, the absence of mucus can cause internal organs as well. We won't get into that, but if there's a dial that block inside your body, inside that sterile environment, because we have flora in there too, that mucus, absence of the mucus, can cause infection. You need to have mucus in your nose, and you're designed to breathe that wonderfully moist air exiting your body through your nose. Now you may say that you buy a humidifier. Guess what? Mother Nature gives you a natural humidifier, and it's called the exhale. Do that to a mirror. You see condensation, moisture, wetness, right? You want that exhale through your nose under normal circumstances with most people, but I don't know about you because I haven't done an exam and treatment on you. Now, we talked about exhale. Let's talk about the inhale. How should you inhale? Because don't forget, obviously, breathing is two parts. How should you inhale? I want to hear you say, we only have two choices, right? Mouth or nose. But before you even answer that question, answer me this. What else do you have inside your nose? Here, as we said, with the mucus, blood, exactly. Blood supply, right? Because when you get punched in the nose, or sometimes without any reason at all, people just have spontaneous bloody noses. It's very vascular inside your nose. And it's not just blood vessel like any old vein. These are very thin-walled membranes. Very thin, so thin that the blood leaks out. It's thin because Mother Nature put that apparatus inside your nose full of red blood cells. And what does the red blood cell do? Hemoglobin, right? Iron it contains, it binds oxygen. The reason why you have a red blood cell in your body is it can go through your body and distribute oxygen. So, my question to you now is that you know some of the basic physiology is, why would Mother Nature put all that apparatus of blood cells in your nose? And you're right. To take that breath in through your nose. And the most oxygen, and you may say, well, we have the mouth, we take the breath into the mouth, and that's true, and it goes right to the lungs. So what is the problem? The problem is you have two apparatuses. You do have the lungs, you're right, But you also have this apparatus in your nose, and it goes right into the brain, and the brain is the most oxygen-sensitive structure of the entire body. If you think about what fainting is, right? Fainting is when someone is maybe in shock, they see something and they faint. It's because the sympathetic and parasympathetic nervous system creates the blood decreases basically, the blood pressure, altered blood pressure, the blood decreases, and your body has no more, your brain has no more oxygen, so you fall, so the oxygen goes. And that's why they say, make sure you, if someone faints, you lift their legs up so all the blood rushes to the head. My point in saying this is, you have to remember that the brain, being the most oxygen-sensitive structure of the body, why would you want to deprive the brain of oxygen when it's a direct route to the brain, and it goes down into the throat? Obviously, that jet stream of air goes down into the lungs, so you have two routes of entry for the oxygen. The brain hits that first, most oxygen-sensitive structure of the body, and also it goes into the lungs to be distributed to the rest of the body. You were designed, as far as I'm concerned, my opinion, is to breathe through your nose. Now, if you look at children, how about babies? Let's go babies. Babies, they breathe. You don't see babies with their mouth open. And as a matter of fact, I had a patient that was a photographer, and she would take photography, wedding photography, and she would avoid those people sitting there with them up. They just look, as smart as they may be, it doesn't really look, it looks dumb, actually. So you don't want to, go on an interview, it looks dumb. This is a reason, and it looks horrible because it is horrible. So what did we learn? We learned that proper, normal, average, everyday breathing for most people, and I'm not sure about you because I haven't done an exam and treatment, physical exam, haven't done a physical examination, so I don't really know exactly about you, and I'm not dispensing medical advice to you because I've never done the exam in history. But I'm telling you what I've told vast majority of my patients for many, many years with excellent result, and it all kind of makes sense. So I want you to think about this and take it to your medical doctor and ask the tough questions. Now, breathing, you have a choice between your nose and your mouth. I have to give you some very good reasons why, for most people, breathing in and out through your nose is the best thing. I understand people have deviated septums. I understand people have different reasons why they can't always do that. But in normal circumstances, the way the body is made is conducive to breathing in and out through your nose. The other thing I want to talk about is balanced breathing. Now we'll talk about physiology just for a couple of minutes. Your heart, your whole entire body, for instance, is controlled by two systems, yin and yang, okay? The ancient Chinese system, yin and yang. You can call it the male and female. In scientific circles, they call it sympathetic nervous system, which is the male masculine side that tightens things up. And we call it the parasympathetic nervous system that relaxes the body. So you have two wires. I call them wires because they conduct electricity, actually, but we call them nerves, right? But I call them, think of them as wires because they conduct electricity. And the two wires say to the heart, and one wire speeds it up, it's a sympathetic nervous system. The other wire slows it down, it's the parasympathetic, yin, yang, male, masculine, whatever you want to call it. And they have to be in perfect harmony if it's too much. Now, I had a professor in chiropractic college who said she was also a nurse, and she put a suppository in the anal region, and that's where the parasympathetic nervous system is. And the person had heart failure. Why? Because she stimulated the parasympathetic nervous system when parasympathetic slows things down, and it slowed his heart down to a very dangerous level. So my point in telling you this is you have to remember there's such a thing called the yin-yang, or the parasympathetic and the sympathetic nervous system, and they have to work in harmony because one speeds things up, tightens things up, the other is more relaxation. So my question to you now is, does the sympathetic or does the parasympathetic system control breathing? Okay, well, someone's okay, so one of you is probably saying sympathetic. I see someone else saying parasympathetic, right? It's both. Both of them do. Don't forget, we have the inhale, we have the exhale. So the question, kind of a trick question. The question really is the inhale. When you have to take that air in through the two small nostrils of your nose against resistance, unlike the mouth, right? A larger opening, there's not much resistance. You have to use a muscle to suck that air in, sympathetic nervous system. And when you let it out, ready? It's relaxation, right? It's called the relaxation response. There's books written on this. And that's the parasympathetic nervous system. So my point is, just like we talked about the heart, we want this parasympathetic and the sympathetic nervous system to be in fine balance for your whole body. Because your sympathetic and your parasympathetic nervous system controls your whole body. We're talking about digestion, metabolism, thought process, stress, depression. We're talking about everything you can imagine with your body, including the sexual response, but won't even get to that part. It's controlled by the sympathetic parasympathetic. Everything in your body, okay? Romantic interludes, everything controls. So if you can control and balance your sympathetic nervous system and parasympathetic without drugs, if you control that, that would be a good thing. It could eliminate. So for instance, let me just bring this home. There are people that have, say, constipation, irritable bowel syndrome, constipation, diarrhea. Let's just talk about that for a minute. Now, when you eat, what makes the food go through your system? It's what we call peristalsis. It's what we call with the internal intestines, they tighten up, sympathetic nervous system, then they let go. Parasympathetic, tighten up, let go, tighten up, let go, tighten up, let go. And it pushes the food through a process called peristalsis. But what happens if it's unbalanced? And what happens if you have an increase or overload or not enough of, too much of the sympathetic, not enough of the relaxing parasympathetic, so you have to have tightness, constipation, because it just stays in your body, holds your body, and the longer it's holding your body, the more that the body is taking absorbing all the, wetness, it's just absorption, and it stays in the body, and it becomes very hard. My point is, I told you I'm going to tell you some vivid examples so you will never forget this, right? What you want to do, and if possible, I'm not saying it is, if you can balance your breathing, the ancient Indians say, and many of my patients reported help for them, may not for you, if you can balance your breathing, you can balance your sympathetic and your parasympathetic nervous system. And if you do that, you can think better. We'll talk about that in a minute. And your whole body, digestion, but every part of your system, every physiologic function of your body is going to be more in harmony. That's what you need to know. Now, if you get on the stage and you have to recite something, or if you have to ask that attractive person for a date, or that boss for a raise, or you raise your hand in class and you're scared, or you get called on in class and your heart is racing, that sympathetic nervous system, people, that's stress. And it's not horrible either. Stress is not always horrible, but it's stress. And what's the best thing to do? So you sound better when you're being interviewed at that job application, or you sound better when you ask that person for a date or the boss for a raise. What is the best thing to do? Is to breathe. They always say that, right? Get on the stage, you feel the nerve, you take that breath. Why do they tell you to take that breath? Because little do they know, they're telling you to balance the sympathetic and the parasympathetic nervous system so you could be in harmony to deal with the stress. My point is this. This is what I want to talk about. When you take that, every day of your life, when you take a breath, you should always be breathing through your nose. Most people, maybe not you, I don't know, I've never done a history and physical exam on you, but most people. When you exhale, you want to keep it moist, you want to exhale through your nose all the time, every time. Of course, when you're eating and talking, it might be different, but you want to do it consistently. And you want to even your breath, so you're not taking like a short in-breath and then a very long exhale. You want to maybe lengthen the exhale, because that's the parasympathetic nervous system, the system that relaxes you. But it should be pretty even, and they shouldn't be. It should also, we only use maybe a certain percentage of our lung capacity. You want to sometime, not all day, not when you're sitting in class maybe, but every once in a while, it would not hurt. And that's the best thing about aerobic activity. It makes you increase that respiration, makes you use all the lung capacity instead of just the 20 or 30% of lung capacity that we generally use. And your tissues, I can go into this, but I won't. Your tissues are, when they get oxygen deprived, that's when we have all kinds of problems, including muscle soreness, aches, and pains. And I want to leave you with this. Breathing is consciousness. That sounds really esoteric, but let me bring it home for you. Breathing, how you breathe is determined on your state of mind, right? So you're hot and passionate with your, person, with your significant other, you're breathing differently. When you're have to give a recitation in front of a group of people, you might be breathing differently. When you're when you're scared or nervous or upset, you're breathing differently because your body is tensing the blood vessels in your body. And there's all kinds of enzymes and hormones that are creating you breathe. My point is, you can override the breathing. So when you have tense breathing, because your sympathetic nervous system is kicked into effect, and that professor just asked you a question you don't know, you don't want to be a fool in front of your classmates, and you're all tense and tight, and your breathing is mirroring how you feel. What I'm saying is, however tense or tight and stressed you may feel, maybe you're driving in traffic, let's just say that. You breathe in. I'm just showing you. And you breathe out slowly at the end. Not going to cause, no, it's not going to cure the world of all its problems, but it can certainly make your day completely stress-free. So if you do this one thing, let's all do it together. If we do it with me right now, we go in, and I'm just conducting, like a conductor of music, but conducting and hold it just for a second. Like that. All you have to do. The hardest thing in the world to do is to relax through breathing. So when you lie down at night and your mind is swirling with the day's events, and then what you did today, and also what you have to do tomorrow, it's very, tough to concentrate on your breathing. It's the hardest thing. It's very easy to say, just take 10 breaths. People cannot take 10 breaths. Concentrated, meditative breaths. You count to maybe 4 or 5, and you do maybe 6 or 7, a little elongation at the end, because that's the parasympathetic nervous system that relaxes us. That's what I want you to do, and they can't do it in 10 breaths. Because all of a sudden when they relax, that's when all the memories come up from childhood or from yesterday or from what you have to do, and all this stuff just comes up. And I can tell you right now, a lot of people are invested in keeping stress because they hold everything in from before. Maybe painful memories, or maybe things they don't want to think about. And what breathing and relaxation does is it brings all that stuff up. And there's not a muscle therapist out there that does muscle therapy and maybe yoga and chiropractors that don't have people relaxing that end up having these emotions come up. Sometimes they cry. Sometimes they get angry even. They have emotions come up, and that's normal and it's good. If they're too much, then you get you talk it over with someone, even professionally. But usually it's just these things like, wow, and the light bulb goes off. There's a lot that can happen when you breathe correctly. It can change your life. It really can change your life, and I've seen it. It costs no time, and it costs no money. It just takes a little effort, and only in the beginning. So I recommend that if you, this is way too big actually, but if you put an elastic, and every time you catch yourself, just snap it. Or every time you catch yourself, thinking a negative thought. And if you ever see those dragon photos, we breathe out, don't forget, we're breathing out toxicity. So carbon monoxide. And so think about, when the dragon, you see the little puffs of smoke, right? Think about that. And think about every time you take a breath in and you have negative thoughts come in, right? You can think about and imagine in your mind, when you let that out, let the negative stuff come out to the universe, send it away. Because you don't want to keep it in. Keeping negative emotions, thoughts into the body only ends up destroying the body and creating dis-ease. Not an ease, but dis-ease. And there's tons of stuff I could talk about that. Many books written about that. But suffice it to say, this is a breathing video, and I would be very happy when people would just breathe simply in through your nose and out your nose. That's 90% of what you need to know. The other stuff you need to know is, and I'm sure you do it anyway, and it's natural. It comes out natural, and that is when now I want you to do now we'll talk about the energy stuff for people that are lost. When you're talking in a small group especially, you can notice it. And maybe the situation is tense. Maybe there's, I don't know, a meeting. Maybe they're talking politics, right? Whatever it is, and maybe you're discussing something even nice. And I'm sure if you do this, you will see how you can affect and the reaction of other people. You can change their energy. And what you do is you just simply, you don't have to even make it obvious, but you could just hold it, let it out. It'll change their breathing too. It's most noticeable one-on-one, okay? Intimate relationships, notice this. But in a group, in a classroom, even on the phone, you change it, you can hear the other person change too. Now that I taught you about how you're supposed to breathe, and now I talk a little bit about the energy. There's much more I'm going to say. A little bit about the energy. You watch how you can change the world, the external world. Not just you, but the external world. Your surroundings can change based on how you breathe. I have much more I could say. I've talked about this forever, but I hope I gave you some food, breath for